I'm not a water rat. Some people say I look foolish when I swim, but this water workout may be the only thing that completes my recovery from the surgery Dr. Mark Philippon did to repair torn tendons in my hip.
Down and back up.
I was improving in the 5 months since surgery, but I was still limpy. So I turned to leading water workout expert Lynda Huey, who has published numerous books and DVDs on water's benefits.
You have the water lifting you up, so there's no trauma, no impact to your weight-bearing joints, and at the same time, you have the resistance of the water to work against. You can work really powerfully, get good strength in the muscles around those joints.
Try to bring it straight across your body, Bruce.
Kevin Wagner, Lynda's chief sports therapist, has been working me out with stretching and strengthening exercises twice a week on land, and he agrees with her.
I think the combination of two is the most beneficial thing for any individual. There's things I can do in the pool that I necessarily can't accomplish on land. Less impact on the joints just allows people to be able to work at a higher level and accomplish things that on land would be a little bit too challenging.
Huey says the workout treats a wide variety of problems.
Elite athletes, recreational athletes, people who wish they were athletes, people with injuries to their knees, their ankles, their hips, their shoulders, their backs.
Triple jumper Talita Lurilo is recovering from a serious injury that threatens her chance to compete in the 2012 Olympics.
My injury is to my right knee. I tore my patella tendon, which, yes, very, very painful.
That pain and swelling made land workouts difficult. The same was true for weekend warrior Brian Levant, who may eventually need hip replacement for arthritis.
It's my intention to continue playing and do so with original parts.
Whatever their diagnosis is, we will give them specific exercises for that. So half the program is pretty generic for everybody, the other half is very individualized.
Just as Kevin, Lynda, and other therapists tailor the workout to each patient's needs, Lynda tailored mine, and we demonstrated in a separate pool. First, cardio and strengthening in the deep end. Then I take off the flotation device and move to shallow water. Side lifts for the hip, front and back movements, circles, and rotation, all to strengthen injured muscles and to increase stability, which Lynda and Kevin told me was crucial to get rid of the limp.
On land, we found that the muscles weren't stabilizing your hip enough in order for you to be functional. Makes it look so easy. From a functional stability component, you still had the limp, which was your biggest concern.
Although the experience is different for everyone, some of Talita and Brian's experiences were similar.
When you're in the pool, because it's resistance all the way around the body, you really get a workout more than you would think you would, which I think mentally is great for any athlete.
If the pool therapy allows me not to have surgery, I will be delighted forever, and if not, then I would go into that surgery as strong as I could be, rather than as weak as I was.
There's nothing the pool can't help with.
After 4 weeks on land and in water, I'm convinced the combination works for me.
I see things improve in the water when nothing else has helped all the time. It's just a magical combination.
Oh. Hamstring? Nope. Yeah.